For the treatment of hypothyroidism, my first recommendation is always going to be levothyroxine unless there's a contraindication or a problem with using it. Levothyroxine is T4. It is the principal thyroid hormone made in the thyroid gland. Its generic is levothyroxine, and it has many branded forms as well, such as Synthroid, Tyrosint, Levoxyl, and there's more. After we've made dose changes and tried branded, tried generic, and someone's still not feeling good, my next recommendation would be to add a drug called Liathyranine, which is T3, and its brand name is Cytomel. The thyroid does make, like I said, mostly T4, some T3 as well, so we're trying to replace what the thyroid gland would normally be doing. Some endocrinologists are opposed to using porcine thyroid preparations, such as Armour Thyroid, WP Thyroid, MP Thyroid. I do use these drugs. I think that the amount of T3 in them is way more than the thyroid gland would normally make. And for that reason, I don't think they're safe to use in certain populations, such as people with heart disease or people pregnant or considering pregnancy. So when I finished my fellowship training almost a decade and a half ago, I was under the impression that for my patients with hypothyroidism, once I titrated the dose of levothyroxine and got the TSH adjusted, that all of their symptoms would disappear and they'd be feeling better. And within a few years of seeing patients, I realized this is not the case, that my patients with Hashimoto's thyroiditis, despite having good-looking TSHs and apparently good doses of thyroid hormones started, continue to struggle with migraine headaches or vague stomach upset, fatigue, joint problems, skin problems, mental cloudiness. I have no formal training in integrative or functional medicine, just a great interest in it. And I believe that a lot of patients who have Hashimoto's thyroiditis, the continued symptoms are likely related to the inflammation that comes with a disease process and not as much related to the hypothyroidism itself. I spend a large portion of my time with my patients with Hashis talking about strategies to minimize inflammation. And I've found over the years that these strategies, dietary changes, seeing an allergist, changes with exercise, getting enough sleep, seem to make the biggest difference tend to make a big difference for patients with Hashimoto's, in addition to or after we have the thyroid hormone dose well adjusted.